Welcome, friends, to another episode of CNS Viewpoint. Today, we are going to talk about a very important milestone which India crossed yesterday, and that was 100 crores or 1 billion vaccine doses administered in the country in 278 days. So, in 278 days, India administered a billion vaccine doses. This is really commendable given the condition of our health system, and and for so many more reasons. No country was prepared to do this kind of mass vaccination and the kind of infrastructure and necessary facilities which are required. So 100 crores or billion vaccine doses in 278 days is commendable. Also, it is important to note that the vaccine, although there are challenges, of course, we can discuss those too. But let us first talk about the good which has happened. That although India aspired to administer about 10 million or 1 crore doses every day, every single day, but actually that target was barely met 2 to 3 times. For most of the days, the average vaccination was very low. I think in May it picked up. In May it was about 19.69 lakhs or 1.9 million. In June 2021 it was 39.89 lakhs or 3.9 million. In July it went up to 43.41 lakhs or 4.3 million. In August it further went up to 59 lakhs or 5.9 million. In September, it shot up to 78.69 lakhs or 7.8 million. But in October, it fell down to 53.2 lakhs or 5.3 million. So this is important that, although we have administered so many doses, but the progress or the rollout is not equitable. So there are some states like Kerala, like Himachal Pradesh, like Sikkim, where you have way more vaccination, fully vaccinated percentage of population compared to the national average. So in India currently we have 20% of fully vaccinated people, but in Kerala you have many more. In Himachal Pradesh, in Sikkim, and there are states which have done way better than the national average. But there are states which are lagging far behind, like Uttar Pradesh is the worst, Bihar, very appalling, and in terms of fully vaccinated percentage of their population. So this is no excuse that these are bigger states. If they are bigger states, then why is the health infrastructure so weak and fragile? Why the systems were not put in place? So those are the important questions. Those are the important reflections which will force us to find solutions to these problems, because whether it is a rich state or a poor state, whether it is a developed state or a developing state or least developed state, whether it is a rich country or poor country, whether it is a developed nation or developing nation or a least developed nation, we need to vaccinate 70% or more, minimum 70%, at least 70% of the population of every single country, every single place, 70% of the human population on the planet. If at all, we need to have that hope of invoking herd immunity and thereby decimating the pandemic. Having said that, we also need to remember that vaccine provides very important protection to an individual by reducing an individual's risk, significant reduction in individual risk for contracting any serious outcome in the event if that individual gets infected with coronavirus. That serious outcome also includes death. So in countries where the vaccination rate is very high, like Singapore, like US, like European nations, etc., you will find that when new infections happen, in that proportion, the hospitalization, ventilator requirement, death rate related to COVID is not increasing. In that proportion, that is a less need for that. But in countries where the vaccination rate is low, you will find much more need for proportionate increase in hospitalization requirement, ventilation, death rate, alarming difference. So it's very, very clear that if it's a scientifically approved vaccine, validated vaccine, WHO approved vaccine, it's more likely to protect population and reduce the risk of from serious outcomes of COVID. So please do go ahead for the vaccine. But also at the government level, it is more important to ensure that all the states, all the people, all the provinces, all the cities, all the villages, everywhere the vaccination is happening at a very rapid pace, because within a short duration of few months, 9 months or something like that, we have to vaccinate 70% of the population to at least. So there are countries which have done very well in the same period when India rolled out 100 crore doses or a billion doses. China has rolled out 2.3 billion doses. If you talk in terms of number of population, India has 20% fully vaccinated people. Look at China, look at US, look at so many other countries. Singapore was the first country in the world which vaccinated over 80% of its population, fully vaccinated. There's so many more countries which are fully vaccinated people in 50%, 60%, 70, 80% or more. And now countries, rich nations, despite World Health Organization saying do not go for booster dose yet, there are countries which have started rolling out booster dose. And we need to look at science. I understand the reasons that it is important to ensure that more and more people are getting fully vaccinated. At the same time, we also need to remember we began the vaccination in January 2021. So people who got, and who were the people who were getting the vaccine in early on? They were whom we considered, the science considered most at risk. Frontline workers, healthcare workers, a range of frontline workers, senior citizens, etc. So if their protection level because of vaccine is on a decline, should not they get a booster dose? So while we are increasing the number of people who are getting protected by the vaccine, we also need to ensure that the people whom we have protected by vaccine, they continue to remain protected, because the virus is still out there. So on booster dose, we need more science, we need more clarity, we need more scientific guidance on how to roll out the booster dose, who should get it first, etc., etc. But we can't, have this confusion on booster dose. We should have more clarity and scientific rationale, of course, scientific rationale on booster dose. So. Similarly, the vaccine timings are important. Like in the holidays, the vaccination centers are closed or shut down. Why? Actually, in holidays, it is more convenient for people to walk into the vaccination center and get it. Why are we forcing them to quit their work and go to a vaccine and get the shot? That might not be a very feasible. That might be a possible blockage, a barrier. So we need to remove these barriers, and this is not rocket science, because we have already implemented this for other diseases and conditions and health services to reach out to more people, to make it more friendly, more convenient for people to access these services. So likewise, there was a promise to reach out to people who have restricted mobility, or people with disabilities or senior citizens, and deliver vaccine at their doorstep. Is it happening? And we really need to come up in this service mode. We have no excuse. The Drug Controller General of India, has to review the phase 3 data of all the available vaccine in the country. For how long the vaccines which we are getting will be rolled under emergency use authorization. So and why? It's almost a year, right? And also, it is important that, India has delivered 100 crore doses or a billion doses. But these doses, most of them, 89% of these doses were Covishield. So now, before I go into that, let us remind ourselves, India has approved 6 vaccines. Out of these 6 vaccines, only 3 are being rolled out. Covishield, Covaxin, and Sputnik. Only 3. So why are the other 3 not being rolled out? Moderna, Johnson & Johnson, and Zycov-D. All those three are also approved. Not a single dose has been rolled out. Why? So, and now among the three which are being rolled out, Covishield, Covaxin, and Sputnik, Covishield is the vaccine which has been delivered to doses. 89% of the doses delivered are of Covishield, made by Serum Institute of India. Thank you, Serum. Imagine, because the capacity of Serum Institute of India, and it was already the world's largest vaccine manufacturer before the pandemic struck the world. So we had that kind of manufacturing capacity already in place, and that is the strength of a country. Bharat Biotech has to really buckle up. What about delivering on those promises of delivering many more doses of Covaxin? We need to and Sputnik. So 89% of these 1 billion doses administered in the country are Covishield. 89%, 11% 11 or so is almost Covaxin, and very small tiny percentage is Sputnik. So all these, and the other three, zero. Zycov-D, Moderna, J&J, and all six are approved by the government. So why are all the vaccines which have been approved by the government not being fully manufactured, fully rolled out, and fully manufactured full to capacity, so that we can even export to other countries? Under Maitri program, the friendship program, but also for export. And also open the gate to other WHO approved vaccines like Pfizer and others. Why not? So we really need to ensure India has a population of about 1.4 billion people. So if we want to vaccinate everyone, then it will be 2.8 billion doses required. But as of now, at above 12 years and above are eligible. So according to that, 1.11 billion people are there in the country above 12 years of age. So we need 2.22 billion doses. We have already crossed 1 billion. We have 1.22 billion more to go. And Government of India says we will vaccinate all those eligible by end of this year. So there are 70 days left, 1.22 billion doses to be administered. Let's hope we are able to do that. And my prayers for that. And also we are able to do that in every other country, so that every other country, all the global population is able to fully vaccinate themselves in the given time frame, so that we have the best chance of invoking herd immunity worldwide and making pandemic a history. With these words, I will conclude today's CNS Viewpoint, and I will be back again tomorrow at 5 p.m. with our thoughts and views and perspectives on something that made us think. Tomorrow at 5 p.m. again. Bye-bye. Stay safe, and please get vaccinated if you're eligible and if you can. Thank you. Bye-bye. And even if you have got vaccinated, wear a mask, maintain social distancing, all hygiene practices, etc. in place. Remember, safety is very important. Till the time pandemic becomes history. Bye-bye.